Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Glad that you could join us. You know, at this time of year, hiking, camping, gardening, those are just some of the most popular recreational pastimes among many outdoor activities, but they can also pose a threat to the health of your patients and folks not necessarily that are undergoing a doctor's care. New findings show that not only a spike in the prevalence of Lyme disease between 2016 and 2017, but also a rise in Lyme disease in areas that aren't typically associated with this tick-transferred disease. Joining us now to help understand who's at risk as well as prevention and protection surrounding this problem is Dr. Harvey Kaufman. He's Senior Medical Director for Quest Diagnostics and head of the company's Health Trends Research Program. Welcome to the program, Dr. Kaufman. How are you?
Wonderful, Neil.
Great. I thank you for taking the time. And I gave a little bit of your background. A little bit deeper into your background, and let's jump right into this discussion of this spike in Lyme disease here in the United States.
Sure. So let me first start with describing Lyme disease. It's caused by an infection by a bacteria called Borrelia burgdorferi. The bacteria is carried by the black-legged tick, and the western states is the western black-legged tick. The tick needs blood meal to progress from one stage to the next stage in this development. And if infected from a previous blood meal, it can infect its next host, whether it's a cat, a dog, a deer, or a person.
Is there any new research that's revealing things that we didn't know previously about this disease?
Yes. So we have thought about Lyme disease as primarily focused in the Northeast. And we're talking about the 6 New England states, Pennsylvania, New York, New Jersey, Maryland, Delaware, Virginia, and Michigan and Wisconsin. That's where the focus has traditionally been. Mm-hmm. There have been reported cases here and there, and in our study, we were able to demonstrate that there is Lyme disease everywhere. And there's been dramatic growth, particularly in California, Florida, and we saw significant increases in states like Georgia, Arizona, Ohio, Texas, and Tennessee.
Was this information gathered by just monitoring people coming into the doctor's office, or were there surveys put out? How exactly did Quest get the information needed to generate this health trends report?
Sure. Quest Diagnostics is the largest clinical laboratory provider in the United States. And for this study, we have arguably the largest database of laboratory results with more than 44 billion test results. We pulled out more than 6 million Lyme disease test results from 2010 to 2017. That's an 8-year period. And these are results from patients who went to their doctors because of suspicion for Lyme. And for this study, we looked at patients who had what's referred to as IgG antibodies to the causative bacteria that were then confirmed with a second test called the Western blot. And in this health trend study, we identified nearly 200,000 patients in the 8-year period and nearly 36,000 in 2017. And because of our national footprint, we can look at patients who test positive in all 50 states and District of Columbia.
Well, obviously, there have been some preventative measures, communicated to the community throughout the years. Have those measures been overlooked? Is that one of the reasons that we're having this spike in prevalence? Or are there new guidelines for the prevention of this disease?
The guidelines are the same in terms of prevention. What this report aims to do is to raise awareness from both the physician community and among patients that if one is suspected of having Lyme, to go to the doctor. If you have a rash, if you have symptoms that don't resolve, go to the doctor. Because Lyme disease, particularly in the early stage, but even as it progresses, is generally treatable with antibiotics.
Is it a long-term treatment?
The antibiotics are short-term, but there are people who do progress. There's no clear division among the different stages. They're referred to as local, disseminated, which means it's spread and persistent. If the disease is not treated quickly, it can disseminate and generally occurs about 3 to 10 weeks after infection. And about 1 in 4 people who do present with a disseminated Lyme disease, which can affect the large joints, particularly the knee, wrist, ankles, and it can at some point cause symptoms neurological and cardiac of the heart.
Well, you mentioned that the guidelines for prevention haven't changed, even though this spike is a real thing. What are some of the tips that you can give us?
They're common sense. So cover as much skin area as reasonable when outside or near wooded areas. If it's not too goofy, tuck your pants into your socks. Use repellents that contain permethrin or DEET, but always follow the instructions. So don't apply near the eyes, the mouth, the nose, or the hands. Don't apply to newborns. Read the instructions. Walk in the middle of trails. Stay away from grassy areas if you can. When you do come inside, we should take a shower or a bath and then do the full body look over. And when checking children, check the scalps behind the knees, between their legs, around their ears, beneath their arms. Inspect clothes. You can put clothes in the dryer at high heat for an hour, and that will kill the tick. And again, just use common sense.
Is Lyme disease transferred with the simple bite of a tick, the contact on the skin, or does the tick need to burrow into the skin and lodge itself in order for Lyme to take hold?
The tick needs to grab on for a minimum of 36 hours, but the stage that the tick is at when we're typically bitten is small and sometimes hard to see. So as they suck blood, they get bigger. It makes it easier to see. But again, it has to be on for at least 36 hours. If we do see a tick on us, there's no need to rush and yank it out. Think carefully. So the best approach is to find a pair of fine-tipped tweezers that's clean, grasp the tick as close to the skin surface as possible, pull upward away from the skin in a single motion. Don't twist the tweezers, as this can break off the mouth. And if we do see pieces of the mouth, try a second time to grab it. And if unsuccessful at that point, just leave it alone and let the skin heal. Clean the bite area in the hands with alcohol or just soap and water. And then don't put the tick back down. Put it in alcohol, a sealed bag, wrap it tightly in tape, or just flush it down the toilet.
Now, aside from Lyme disease being the largest diagnostic analytics firm here in the United States, what are some of the other health trends reports that Quest has shared either recently or in the past? Yeah,
we've done a fair number of reports looking at heart disease, diabetes, kidney disease, pediatric lead, some unusual ones like Q fever, rotavirus, hepatitis C, a number of different areas. They're all intended to provide insights into the public health, actionable insights that can improve healthcare outcomes. So they're exciting, and they help spread the word to both the medical community and to us as patients.
Are any of these reports distributed throughout learning centers, universities, and things of that nature for folks that are just getting into the medical profession?
Yes, so we do have a website where these reports are available, and the Lyme disease report's available at www.questlymereport.com.
Well, Dr. Kaufman, lots of great information concerning Lyme disease. Thank you so much.
Thank you, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm.